Diabetes. Symptoms, causes, treatment, prevention, and more. Diabetes is one of the most dangerous diseases of our generation. But what is it? Diabetes is a condition where people don't produce enough insulin to meet their body's needs, and their cells don't respond appropriately to this endocrine. In this video, we will dive into details on what causes diabetes, the symptoms, treatment, prevention, and a lot more. So stick with us to the end. But before we begin, make sure to subscribe to our channel for more such informative content. Also, give us a like, share the video, and don't forget to turn on the notification bell for timely updates on our latest uploads. Let's get it on. Some people call it the sugar or sugar diabetes, but the correct term for the group of metabolic disorders that cause your blood glucose level to be too high is diabetes mellitus, or diabetes for short. Glucose enters the body primarily through the food and beverages you consume. The pancreas makes a hormone called insulin to help the glucose in your blood enter your muscles, fat, and liver to be used as energy. When the body does not use the insulin effectively, your pancreas initially produces more insulin to overcome this resistance. But when your pancreas cannot keep up with the demand, the result is hyperglycemia, when blood glucose is too high. So what causes diabetes? Diabetes causes vary depending on your genetic makeup, family history, ethnicity, health, and environmental factors. There's no common cause that fits every type of diabetes, as the causes vary depending on the individual and the type. For instance, the cause of type 1 diabetes vary considerably from the causes of gestational diabetes. Similarly, the causes of type 2 diabetes are distinct from the causes of type 1 diabetes. In fact, type 1 diabetes and type 2 diabetes causes are very different. Type 1 diabetes is an autoimmune condition where the pancreas cannot produce insulin, whereas type 2 diabetes is the body's resistance to insulin. Causes of gestational diabetes. The causes of diabetes in pregnancy, also known as gestational diabetes, remain unknown. However, there are a number of risk factors that increase the chances of developing this condition. They include family history or gestational diabetes, overweight or obese, suffer from polycystic ovary syndrome, have had a large baby weighing over 9 pounds. The causes of gestational diabetes may also be related to ethnicity. Some ethnic groups have a higher risk of gestational diabetes. Those are the three main categories of diabetes. Now let's look at the symptoms. Symptoms. Type 1 diabetes. Type 1 diabetes usually starts when you're a child, teen, or young adult, but can happen at any age. Type 1 diabetes signs or symptoms that can appear relatively suddenly and may include increased thirst, frequent urination, bedwetting in children who previously didn't wet the bed during the night, extreme hunger, unintended weight loss, irritability and other mood changes, fatigue and weakness, blurred vision. Type 2 diabetes. Type 2 diabetes symptoms often take several years to develop. Some people don't notice any symptoms at all. Type 2 diabetes usually starts when you're an adult, though more and more children and teens are developing it because symptoms are hard to spot. It's essential to know the risk factors for type 2 diabetes. Make sure to visit your doctor if you have any of them. When signs and symptoms are present, they may include increased thirst, frequent urination, increased hunger, unintended weight loss, fatigue, blurred vision, slow healing sores, frequent infections, numbness or tingling in the hands or feet, areas of darkened skin, usually in the armpits and neck. Gestational diabetes. Pregnant women have heard tales or experienced it themselves of the orange drink. They have to take around 24 to 28 weeks of pregnancy. It's a story that's passed from women to women about the overly sweet, syrupy taste of the drink and having to sit in the doctor's office for blood tests. But this vital screening is worth the inconvenience. It detects and diagnoses gestational diabetes in pregnant women. Gestational diabetes affects nearly 10% of pregnant women. Gestational diabetes left untreated and unmanaged can pose serious health risks to your baby, including excessive birth weight, preterm birth and respiratory distress syndrome, low blood sugar at birth, increased risk of type 2 diabetes later in life. Most pregnant women don't experience signs or symptoms of gestational diabetes. In fact, the only way to know is with a blood sugar test, typically given around 24 to 28 weeks gestation. A few women may notice subtle signs and symptoms of gestational diabetes, including increased thirst. Drinking more than usual and feeling like you're always thirsty may be a sign of gestational diabetes. Fatigue. Pregnant women are tired. After all, it's a lot of work to grow and support a baby. However, gestational diabetes can make you feel even more tired than normal. Dry mouth. A parched mouth. Despite drinking a lot, can be another sign of gestational diabetes. What are the prevention measures against diabetes? Although there are certain factors you can't change, such as your genes, age, or past behavior, there are many actions you can take to reduce the risk of diabetes. Number 1. Reducing the intake of sugar and carbs. Eating sugary foods and refined carbs can put at-risk individuals on the fast track to developing diabetes. Your body rapidly breaks these foods down into small sugar molecules, which are absorbed into your bloodstream. The resulting rise in blood sugar stimulates your pancreas to produce insulin, a hormone that helps sugar get out of the bloodstream and into your body cells. In people with pre-diabetes, the body cells are resistant to insulin's action, so sugar remains high in the blood. To compensate, the pancreas produces more insulin, attempting to bring blood sugar down to a healthy level. Over time, this can lead to progressive higher blood sugar and insulin levels, until the condition eventually turns into type 2 diabetes. Number 2. Regular workouts. Performing physical activity regularly may help prevent diabetes. Exercise increases the insulin sensitivity of your cells, so when you exercise, less insulin is required to keep your blood sugar levels under control. One study in people with pre-diabetes found that moderate intensity exercise increased insulin sensitivity by 51%, and high-intensity exercise increased it by 85%. However, this effect only occurred on workout days. Many types of physical activity have been shown to reduce insulin resistance and blood sugar in overweight, obese, and pre-diabetic adults. These include aerobic exercise, high-intensity interval training, and strength training. Working out more frequently seems to lead to improvements in insulin response and function. Therefore, it's best to choose a physical activity that you enjoy, can engage in regularly, and feel you can stick with in the long term. Number 3. Drinking lots of water. Water is by far the most natural beverage you can drink. What's more, sticking with water most of the time helps you avoid beverages that are high in sugar, preservatives, and other questionable ingredients. Sugary beverages like soda and punch have been linked to an increased risk of both type 2 diabetes and latent autoimmune diabetes in adults. Researchers on one study on the effects of sweet drinks on diabetes stated that neither artificially sweetened beverages nor fruit juice were good beverages for diabetes prevention. By contrast, consuming water may provide benefits. Some studies have found that increased water consumption may lead to better blood sugar control and insulin response. Number 4. Control your weight. Although not everyone who develops diabetes is overweight or obese, the majority are. What's more, those with pre-diabetes tend to carry excess weight in their midsection and around abdominal organs like the liver. This is known as visceral fat. Excess visceral fat promotes inflammation and insulin resistance, which significantly increases the risk of diabetes. Although, losing even a small amount of weight can help reduce this risk. Studies show that the more you lose, the more benefits you'll experience. Number 5. Quit smoking. Smoking has been shown to cause or contribute to many serious health conditions, including heart disease, emphysema, and cancer of the lungs, breast, prostate, and digestive tract. There's also research linking smoking and secondhand smoke exposure to type 2 diabetes. Treatment. Depending on what type of diabetes you have, blood sugar monitoring, insulin, and oral medication may play a role in your treatment. Eating a healthy diet, maintaining a healthy weight, and participating in regular activity also are important factors to managing diabetes. For those with gestational diabetes, controlling your blood sugar level is essential to keep your baby healthy and avoiding complications during delivery. In addition to maintaining a healthy diet and exercising, your treatment plan may include monitoring your blood sugar and taking the right medications. Symptoms of diabetes may be similar to symptoms of other diseases, so please remember that if you suspect yourself to have diabetic problems, you should contact the medical doctor to get a diagnosis and the right treatment. That's all on our video about diabetes. If you found it helpful, don't hesitate to subscribe to our channel so that you can continue to enjoy such informative content. Also, give us a like, share the video, and don't forget to turn on the notification bell for timely updates on our latest uploads. We value your feedback. Feel free to share your thoughts with us in the comments section below.